But we have more important things to talk about, David. The American health insurance system has been put in scrutiny in a way that I don't think any of us were really expecting by events in the past week. How should we lead into this?
Yeah, I mean, I think everybody knows what it is that we're talking about. And look, it has been, we're going to get into some of the nitty gritty here. But what happened last week really galvanized and started a lot of conversations with folks because it was something that was kind of visceral. And not to be too Pollyannish about this, but like kind of even crossed political lines for many normal people. Now, not
Oh,
yeah.
no. So on that note, I know somebody who's a nurse, and
Mhm.
the nurses from Long Island are making the same jokes that nurses from the Bronx and uh, Brooklyn are.
Well, and like we're going to talk a little bit more in depth about this in a second, is because we have a very murderous system in this country that creates a lot of pain and suffering for folks. And it's just if you were to cast somebody in a play or a movie who you were supposed to present to the general American population as an unsavory character or somebody who you should not have a lot of sympathy for, it would 100%. An easy casting call would be to have that person be an insurance executive in the United States of America.
I mean, look, Grand Theft Auto 5 had a social network CEO that you hit. I'd be wondering if they're going to. So I got a lot of.
Yeah, no worries. Well, I'll just while you're pulling this up, I mean, I will say something that's going to make some people mad because they want to have fun. And look, people want to make memes and joke around and stuff. I get it; those are the conversations that are happening. But it doesn't need to be said too much. But political terrorism or anything like that is something that people should not partake in. It's extremely dangerous for many reasons, and it also it puts too much power and influence on individuals because of the fact of the matter is, even though what happened over the weekend happened, the American healthcare system is going to maintain itself, and those people will be replaced with other people who will play the same role because these are systemic crises and issues that are going to need big movements of lots of people to take on, and they definitely need to be taken on.
That meeting, the shareholder meeting, went on as planned.
Yeah.
So yeah, and that's yeah, and I think how I've been saying it is, and I don't have a whole lot of time for the like Jason Kander guy who ran for office in Missouri talking about it's really sick, or Fetterman, or all these people who had been cheerleading Israeli thing. But I will say, like, I'm not super concerned, considering that this is a nation who, like, the Night Stalker had groupies. But
Hmm.
I think what has happened is what people are being confronted with is a CEO of a private insurance company, and it is insulting to a lot of people's experience to be confronted with that person and then say, feel sorry for him and his family. It just doesn't compute. And so you're going to have a unanimous reaction because so many people have, I mean, and like the amount of stories that have poured in, or people that
Hmm.
you follow on Twitter you
Hmm.
didn't know had that experience of having some certain type of treatment. Like, and it's been kind of crazy that and not unlike, again, like, and we talk about this, like, it is, and I hate to say it, anarchistic, but like Oscar Wilde, when he was asked about, like, if he's a socialist, he's like, I'm a socialist, maybe even border on the anarchist, but the dynamite policy is absurd. Like, where, and what the problem is, like, yes, like, we're having this conversation now. What we're also going to see is a massive expansion of security. Um, so, like, the actual idea that I think this leads to a revolution, I think, is pretty Pollyannish, and ultimately, what needs to be done to remove the national healthcare system is to win enough power to nationalize it through politics.
No, I mean totally, and that's the kind of political lesson, and I understand the moment feeling particularly bleak, and it is noticeable, and we're talking about this in just a moment that like now we're actually having uh, you know Medicare for all conversations again, which seems to be completely out of the discourse for a while, you know. But I wanted to talk about like in addition, there's not, it shouldn't be that surprising to people why something like this galvanized so many folks. Because as we talk about on this program a lot, most people understand their surroundings pretty damn well. And they understand the people who are profiting and waging war against them pretty damn well. What is lacking is not so much the understanding, but actual political avenues on that. And to engage in that kind of project of political understanding, Matt, if you want to put up this first slide here, I wanted to introduce or just break down a concept here that I think has to be included in any kind of understanding about what happened for last week, which is the concept of social murder. Because, for example, if you were whenever something like a assassination or murder happens, you always ask what is the motive, right? And if somebody were to say, "Oh, well, this person, attacked this person's sister, or stole from them, or this person was a military operative that did something horrific in another country," you would understand. You wouldn't say it's not an endorsement of the action, but you say, "Oh, this is I understand the motive here." And I want to bring this up because there is a big aspect of American life where there is murders that are happening all around us on a daily basis, and they aren't recognized. And this concept of social murder, I think, really, really highlights it. This is from Friedrich Engels, in the in the study of the working class in England. When one individual inflicts bodily injury upon another such that death results, we call the deed manslaughter. When the assailant knew in advance that the injury would be fatal, we call his deed murder. But when society places hundreds of proletarians, that's another word for workers, in such a position that they inevitably meet a too early and an unnatural death, one which is quite as much a death by violence as that by the sword or bullet, when it deprives thousands of the necessaries of life, places them under conditions in which they cannot live, forces them through the strong arm of the law to remain in such conditions until that death ensues, which is the inevitable consequence, knows that these thousands of victims must perish, and yet permits these conditions to remain. Its deed is murder just as surely as the deed of the single individual, disguised, malicious murder, murder against which none can defend himself, which does not seem what it is, because no man sees the murderer, because the death of the victim seems a natural one, since the offense is more one of omission than one of commission. But murder it remains. And we bring that up because I think that concept is really important, and it's particularly important in America today, because there are a lot of murderers, mass murderers even, who walk amongst us. In fact, these people are invited to give speeches at university graduations. They are praised on television. These people engage in slaughter of Americans on a regular basis. And yes, it is slaughter. Just because they're not people pulling a trigger doesn't mean that they are not creating the conditions that kill and kill, impoverish, immiserate millions and millions of people. And that goes from the healthcare CEOs to people at Purdue. When you see people dying at a factory, at a meatpacking factory, those are conditions imposed by people in the executive positions of those organizations.
And you see this, I mean, it's wild Engels writing that mid 19th century and how relevant that is to our propaganda defending capitalist
Mm,
states versus some more of communistic ones. Because in America, again, under Joe Biden, the child poverty rate through emergency measures was cut in half. And then they let that program expire, letting child poverty go back up double.
mhm.
And that is just like part of, if like Castro had a policy where all of a sudden the kids had to go hungrier, that would be
Yeah.
all over the
Mhm.
newspapers. It's just part of the natural way things are in this country. And yeah, it's very insidious.
But we'll get back to some of these social murderers in a second. But Matt, I mean, let's just talk about what's going on with the healthcare industry.
Yeah. So, and there's some debate on this that Matt Brunig, who we have to have on the program,
Yes, yes, sir.
honestly, he has this great piece in the People's Policy Project. Let me stop screen sharing and start sharing this again. Um, Healthcare administration wastes $500 billion every year. And he had to write this because on the same day that this assassination happened, Blue Cross Blue Shield, I believe it was, said we want to cut payments to for, and it was reported
Anesthesia. Yeah.
as we weren't going to pay for a full course of anesthesia. In terms, it seemed like negotiations with anesthesiologists, they wanted to cut anesthesia costs. And some people were saying, see, look, it's not all just the insurance. You have these medical providers that also need to be taken down a peg or whatever. And Matt Brunig's piece, I think, helpfully, extremely helpfully,
Should make you angry.
it takes down those bad faith, I would say. And Bruno gets close. He calls them, I think, very questionable
Mhm.
bad faith, and by major writers at like Vox and Matt Iglesias and Noah Smith or whatever. But here's just a few paragraphs that I thought were useful. This is just descriptive here to get your head around something. Think for a second about what happens every $100 you give to a private insurance agency. According to the most exhaustive study on this question in the US, the CBO single payer study from 2020, the first thing that happens is that 16 of those dollars are taken by the insurance company. From there, the insurer gives the remaining $84 to a hospital to reimburse them for their services. The hospital then takes another almost $16, 19% of its revenue, for administration, meaning that
Mhm.
only $68 of the original 100 actually goes toward providing care. Next paragraph, in a single payer system, the path of that $100 looks a lot different. Rather than take 16 for insurance administration, the public insurer would only take $1.60. And rather than take $15.96 of the remaining money for the hospital administration, a hospital would only take 11 or 12% of that revenue, meaning 86% of the original $100 actually goes toward private care. Now, this is not crazy leftists. This
Yeah.
is math. And like when you know just the basics of how a risk pool works, for say a health insurance risk pool, you know that you want the biggest one possible to distribute that risk as widely as possible. And you know what that means? A natural monopoly, which means national health insurance. The UK is not renationalizing trains because Keir Starmer is a Maoist. They're doing it because it doesn't make fucking sense to
Yeah.
have privatized the shit in the first place.
And it has huge social costs, and I know you have more from this article here, but I want to share this graph as well, that he notes, because I think when you put it in these kind of terms, it really should make you angry about the amount of fat that we're providing these corporations, these private companies, these private insurers. So we'll get into some of the reasoning in a second, but this graph for people who are listening, it has comparing excess healthcare administrative costs to other items. And as Matt Brunig notes in his piece, remember that you could sort of misread this. This is not how much we are spending on healthcare. This is just how much waste we are creating. Not how much even that's going to them. It's how much that is wasteful spending. Um, it's 528, which I believe billion. Um, yeah, Social Security. And that is more than public college expenses, federal worker compensation, earned income tax credit, child tax credit, and food stamps in the United States of America. So literally, we are giving more to these bloated companies than we are to hungry people and families.
Yeah, it's a crime scene in more ways than just the
Yeah.
assassination. And
And
here is, yeah,
sorry,
go ahead.
just like and then for every crime, you need an enabler. And remember, it is the politicians that enable the system.
Absolutely.
From both parties from both parties who very much want to protect the private interest. And it shouldn't be surprising that those private interests reward those politicians very, very well.
Yeah, I mean, Kamala Harris got $750,000 from United Health for this recent campaign. Matt Brunig has a comment or a section on this. Imagine setting up an economic sector slightly larger in size than the entire public college sector, but rather than producing educational services for over 13 million students, it produced nothing except frustration and annoyance. That's the extent and nature of excess healthcare administration in the US. It is totally insane, and waving it off as a triviality is really misguided. And there is a huge incentive for certain people to stick their neck out to try to trivialize this, and it can't be allowed. Uh, and then this is another thing that goes toward the is it the anesthesiologists that are actually hoovering up all the money and not these giant parasites. In the analysis so far, Brunig writes, I have implicitly indulged this framing that we should attribute the blame for administrative waste on insurers while attributing the blame for provider rents on providers. But the provider rents are also, in some sense, caused by the private health insurance system. Medicaid and Medicare are able to negotiate much lower rates than private insurance, just as the public health insurer under a single payer would be able to. It is only within the private insurance segment of the system that providers have been able to jack up rates to such an extreme extent. He finishes, I believe, given all this, I think it's totally fair for people to identify private insurers as the key bad actor in our current system. They are directly responsible for over $500 billion of administrative waste, as David pointed out last graph, and at the very least, indirectly responsible for the provider rents that are bleeding Americans dry. Guess what? I have nice insurance now. It is expensive as fuck. The quicker we nationalize health insurance, the better. And just because I can't help but take a shot at, oh, what actually I got, Kyle Kalinske had this graph here, which just shows, speaking of Democrats, profits for our
Jesus
friends at the
Christ. Yeah.
insurance companies. United Health Group in 2013, uh, 8 billion profits basically. Now 32. Cigna was 1.8, now 7.4. CVS Aetna 6.1 to 13.7. I mean, not one that doesn't go up by, I mean, in
Yeah.
some cases, tenfold, 20-fold. And our boy Barack Obama back in 2016 was interviewed by David Sirota, great journalist up.
2006, right?
Sorry, 2006, yeah,
Yeah.
before he was president, by David Sirota, who's now at the lever. And Obama said this. Uh, and Schroeder's talking about his ability to make it seem like he's not ideological. It's a powerful tool for the Democratic Party that often emanates calculation rather than conviction. Quote Obama, I don't think in ideological terms. I never have, Obama said, continuing on the healthcare theme. Everybody who supports a single payer healthcare who supports single payer healthcare says, look at all this money we would be saving from insurance and paperwork. That represents 1 million, 2 million, 3 million jobs of people who are working at Blue Cross, Blue Shield, or Kaiser or other places. What are we doing with them? Where are we employing them? And I've been doing a lot of reading on Obama. I'm standing between you and the pitchforks to the bankers
Mm.
who got bonuses after the bailouts is a great big whopper, but that where we're doing make work jobs to keep people in a industry that again produces nothing but annoyance and headache,
Worse than that, Matt, it produces
kills people.
misery. It,
Yeah,
it, it produces real misery, and you should rage at that. And you should rage at like the systems and the people engaged in the work of making your life work, denying people medical care that they need, denying people, certainly in life saving moments, but also just in giving people the rights to have a dignified life, which means not denying people surgeries that are going to relieve pain, make it easier for them to get by. I mean, everything that we've read about this young man seems to point to the fact that he experienced a horrific medical event and was left to suffer by a for-profit healthcare system, right? That sees people like him, the you, me, all around us as numbers on a spreadsheet, something that they can squeeze and take advantage of instead of human beings who have an entire universe of perspective inside of them, right? An entire world lives within all of us. And these assholes deny us our humanity by turning us instead of, vibrant human beings into equations, into profit. And it is something that is very, very disgusting and anti-human, and something that should infuriate you.
yeah, and the gall of them to give Kamala Harris $700,000 to give between both parties $1.5 million on political spending because you know why? They're a political creation
Hmm. Hmm.
and they can only be destroyed ultimately politically as well.
And look, and we'll just add here, there are a lot of social murderers around us, from the healthcare industry to the titans of industry, to Purdue, to these meatpacking plants. When we could go down the line of people who create death and destruction for profit. And it's people in the Democratic Party, folks like Obama, who preserve, maintain the system. In fact, gave them huge handouts to preserve them. And then there are social murderers, people like my governor, Greg Abbott, by denying Medicaid expansion in the state, something that two-thirds of Texans support. Right now, 1.2 million people who could have health insurance, right, under Medicaid, who don't, who suffer and in anguish for Greg Abbott's political career, right? Again, the calculation that he makes, those are numbers on the sheet. Those are how many deaths are acceptable to him. That is social murder in the same way as all these other examples, right? And there are a lot of forces that we need to confront, and we're going to need to build up movements, as Matt was saying, that have the capacity to take these on not one individual level, but systematically.